Hi, I'm Justin Riley. Today on Wisconsin Doctors, cold and flu season is almost here, folks. It's hard to believe, but pretty soon we'll be dealing with those runny noses and scratchy throats that we all love so much. But we're going to learn a little bit more today about immunizations and antibiotics from our folks at Bluff Medical Center here in Mauston. My guests will include Kathy Noe, who is the Director of Infection Control, Dr. Leon Radant from Family Medicine, and Craig Griffiths, the Director of the Pharmacy. That's all coming up right here on Wisconsin Doctors. Stick around. Welcome back to Wisconsin Doctors. We're here on location at Bluff Medical Center, and cold and flu season is going to be fast upon us before we know it. And so we're going to be talking today about vaccines and other ways of staying healthy during this season. So I want to start with talking with Kathy Noe, who is the Director of Infection Control here. Kathy, it's cold and flu season. Can you talk to us a little bit about what's going on in the community right now?
Currently in the community, we are having some trouble with respiratory viruses that are going around. We've not had too much influenza that I know of, according to cultures that have been done at the lab, but we are seeing a lot of the upper respiratory. And there is a difference between the upper respiratory and the influenza, and a lot of the influenza happens very suddenly. You get severely ill very quickly, whereas a cold comes on slowly. You may have similar symptoms like a cough, headaches, and those kind of things, but the influenza just kind of knocks you out for a couple days and can last for up to 2 weeks.
Yeah.
So,
and Dr. Radant, can you tell viewers what are some things they can do to reduce their risk of coming down with some of these illnesses?
Most of these viruses are spread through secretions, so hygiene methods, hand washing, gels that contain alcohol are also helpful and widely available. Probably as important as anything is just having an awareness of having contact with mucosal surfaces. So if I shake hands with you and I wipe my eye, it's plausible that I may have contracted a virus that you are carrying. So viruses are present in all secretions: tears, saliva, mucus,
everything.
Feces or stool.
If it comes out of the body, then
right.
you're susceptible.
Right. So if you have a virus that has a blister-forming quality, you can get it from that sort of fluid as well.
Kathy, I'm just curious, so what tips can you provide viewers? And I see you brought out some hand sanitizer there
Yes.
for us. Appreciate that. We can pass that all around later. What tips can you offer to individuals who are sick and want to avoid sharing their illness with other people?
the best thing is to stay home. You know, don't go to work, don't go to school, because then you're going to be bringing it to other people in the community, and you really don't want to do that. Like Dr. Radant said, the hand washing works really well. Vaccines can also help with the influenza, but the big thing is not to take it to work or the community.
Stay home. You're not being a trooper by going to work sick, in other words.
No.
Yeah. So Craig Griffiths, I should say, welcome back.
Thank you.
You were on a couple months ago, and you were talking about antibiotic stewardship, which I think is a really, really interesting topic. Can you remind viewers what that is and why it's especially important for them to understand this initiative as we move into cold and flu season?
Well, antibiotic stewardship in itself is simply the prudent use of antibiotics. So in other words, using antibiotics only when we need them, using the correct antibiotic, and using it the right way, so the right frequency of administration and things like that. The critical piece in that for any viewers out there are the appropriate uses for those antibiotics. Antibiotics only work against bacteria, and a lot of the stuff that we're talking about right now, the infectious processes that are going on in the community, are viral. So important to that is appropriate vaccinations and preventing those viral infections, using good hygiene and preventive measures, as have already been discussed, and then understanding that you're likely not going to get an antibiotic in many cases when you think you have a reasonable infection to be treated. So sore throats, where they're typically viral, you're not going to get an antibiotic like you might have in the past. And the whole intent behind antibiotic stewardship is not to limit the antibiotics to the customer, but to actually try and contain a spread of resistance and manage our antibiotics so we use them only when they're really needed.
And there has been cases of antibiotics not working for people because of that resistance.
Yeah, and the whole driving force behind the antibiotic stewardship program is coming from the Center for Disease Control. And they've done a substantial amount of research to determine that there's several bacterial groups that are now seriously resistant to antibiotics and may be a threat, in the future to society because we can't treat them.
Yeah.
So that's the reason we're working to contain the use of the antibiotics and make sure we're using them appropriately.
All very interesting stuff. We got to take a short break, but when we come back, we'll be talking a little bit more about vaccinations and the use of antibiotics. It's Wisconsin Doctors here on CW57. And welcome back to Wisconsin Doctors. We're here on location at Bluff Medical Center in Mauston, and today's topic is vaccinations and other ways of preventing cold and flu and all those wonderful things that we look forward to during the cold season. So first I want to start with Kathy. Kathy, can you talk to us a little bit about some things that healthcare organizations such as Bluff do to reduce the risk of infection for the people that they care for?
We have many educational offerings that include the staff. We also include patients with like hand washing to make sure that those are done before and after care with the patient. We also do vaccinations for our staff to make sure that any of the viruses or diseases that are out there can be prevented in exposing the patients. We do hand hygiene, and we also have isolation practices that allow us to wear the proper gowns, mask, gloves when taking care of people.
So obviously those are things that the staff is all educated on.
Yes.
Going into the season. That's great. And Dr. Radon, we talked a little bit in the last segment here. It sounds like your first recommendation for preventing flu is to get vaccinated. Are there options for people who are allergic to these types of vaccinations or just maybe aren't a big fan of needles?
Yeah, the vaccine that's now available, the bulk of it is produced on egg culture. For those people who have egg sensitivity, egg allergy, there are also vaccines that are developed on cell culture, which are egg-free. For individuals who are between ages 2 and 49, a nasal spray can be utilized with great efficacy. Past age 50, it is not as effective. So those people of my vintage still need to have an injection.
So as you get a little bit older, past 40, up through into your 50s and so forth, the injections work better than the nasal spray.
That appears to be the situation. I was going to comment on what Kathy had to say about staff immunization, and we're very proud of the fact that we've achieved a 98% immunization rate in our staff at Bluff Medical Center.
That's very good. Very
terrific.
good.
Yeah.
So now, Craig, I want to turn to you for just a second here. You know, we've all heard the claims of, vaccines cause autism, vaccines give you the very disease you're trying to prevent.
Sure.
Is there any truth whatsoever to any of these claims?
Well, vaccines are medications, so like any other medication, they can cause some adverse events and some problems, but these are some things that we've been talking about a lot. The original study that was conducted to determine the relationship between autism and vaccines was actually flawed at best. It has been since debunked, and the CDC tells us that they can't validate any actual relationship between the development of autism and vaccine and being administered a vaccine. The one thing that they recently published that I found interesting is that they have been able to identify the existence of autism in utero, which would suggest that it exists before birth and therefore would not be vaccine related at all. Certainly a side effect might augment a manifestation of it, but it would appear that it has nothing to do with the vaccines at all. Now, as far as getting the disease from the vaccines, most of our vaccines are particles of viruses. They're not the entire virus. The ones that are complete viruses, those viruses have been killed. So there's no way that a patient can actively get infection from our vaccines. Now, what you can have happen, though, is you are mounting an immune response to the vaccine. That's how you develop the immunity that prevents the disease. And that immune response can mimic any kind of viral infection. So the things you would expect to, for instance, with the flu vaccine, the things that you would expect from the flu, muscle aches, fever, maybe some headache, stuff like that, certainly could happen with the vaccine as well, because you're developing an immune response just like you would if you were exposed to the virus itself. So it is possible, but certainly at a much lower grade, and not actually the infection itself, but just the immune response to the vaccine.
So it may not feel pleasant, but it's certainly a lot better than getting the actual
Absolutely.
illness. And it's not even the illness. It's just your immune system's response to what it sees as an invasion into the body.
Absolutely.
So, yeah.
If I were to just comment a little further on what Craig has already said, the paper that really talked about tying autism to immunization was specific to a measles, mumps, rubella vaccination. It was published, I think, in 1998, by Dr. Timothy Wakefield in The Lancet. His data was not just misinterpreted, it was invented. And his academic credentials have been stripped away. His medical degree is no longer with him. So, unfortunately, the damage has been done. And even though The Lancet retracted this paper, it is still something that people who are opposed to immunization grab onto.
Yeah.
So it's really difficult to have people who are celebrities use this kind of reference in citing why they're opposed to immunization, because the science behind it was clearly not even just faulty. It came out of thin air.
It was false. It was false. We got to take a short break. This is a really interesting topic. Don't go away. There's more Wisconsin doctors coming up right after this. Stick around. And welcome back to Wisconsin Doctors. We're here on location at Bluff Medical Center in Mauston, and we're talking about vaccinations and antibiotics and all the things that help us deal with the runny noses and all those sorts of illnesses that are coming up very soon as the cold weather approaches. So Kathy, I want to start with you. You often hear people say they have the flu when maybe they're just sick. Can you talk about some of the symptoms of the flu and how they differ from, let's say, a stomach bug or some sort of other virus or some sort of other infection, like bacterial infection?
Sure. With the influenza, basically you kind of feel like you're dying because you are just not feeling well at all.
Oh, that's encouraging. I just feel like you're dying. No big deal.
But you do make it through it normally without any complications. Some people, especially children, will have some GI distress with it, which means they may have some vomiting and diarrhea. Most adults do not get that. And so when they call the stomach flu, it's really a GI distress, and it's not the influenza that we're talking about. So influenza is usually the upper respiratory, or it bothers your breathing, you get the fever, the cough, the headache, those kind of things, and not so much of the stomach GI distress.
So the nausea and vomiting, when people say, oh, I've got the stomach flu, it's probably not the stomach flu, it's probably just some sort of stomach bug or something that got made their GI in distress, is what you said.
Distressed, yes.
Yeah. Dr. Radon, what treatment is available for those who actually do come down with the flu?
Usually it's symptomatic treatment. Drinking fluids, using medications commonly available over the counter. Tylenol, ibuprofen would be drugs commonly recommended to get through the symptoms. There are also antiviral agents. Probably the one most commonly noted is Tamiflu, or oseltamivir. This drug has neuraminidase inhibition. It shortens the course of the illness by about a half a day, and it costs, last time I looked at it, about $120. So it's clearly best to simply invest in the immunization, which is far less costly and far more effective.
Yeah, and in some cases you can get for free, like at a pharmacy or something like that. They give out free vaccinations for those types of things. So,
yeah, I mean, when you factor in the lost work, lost time at school,
yeah,
needing to be away from daycare, I mean,
right.
this all becomes very pricey.
Yeah. Yeah, and it's not always something we think about because it doesn't have an immediate consequence to it. Craig, I want to talk to you for a little bit because the Center for Disease Control put out something called the 6 Smart Facts about antibiotic use, which I think is really cool. Can you talk to us about what those are?
Sure. Well, the first smart fact is just remembering that antibiotics are or have life-saving potential. And if we misuse them, and because of that experience widespread resistance and things like that, we lose that life-saving potential in some
right.
cases. And so the first fact to remember is that we want to use antibiotics only when we need to and use them appropriately. Second thing is to remember that they don't work for viruses, they only work for bacteria. So if you don't have a bacterial infection, you're not going to get a prescription for
right.
an antibiotic. And some of those infections would include things like ear infections. Not all ear infections are bacterial, and so there may not be a reason for an antibiotic. Sore throats are commonly caused, in fact, most commonly caused by a virus.
Right.
Only about 10% of sore throats are actually caused by a bacteria that would be treated with an antibiotic. Having colored mucus doesn't necessarily indicate an infection.
Really?
It may be a marker that you want to let your physician know about so that they know when it started and that kind of stuff, but it doesn't necessarily mean that you have a bacterial infection that needs to be treated with an antibiotic. And then probably the last thing that we would share with folks is that there are risks to using antibiotics. They're drugs. And so there are significant risks. In fact, last year there were 142,000 admissions to hospitals through the emergency department because of an antibiotic and a reaction that it caused. Most commonly an adverse reaction like an allergic reaction.
Sure.
But they're not without risk. And so misusing them or using them when you don't need to, or for even that matter when you do need them, they can cause some problems. And so it's appropriate to be prudent with our use and to use good judgment and rely on your physician to give good advice and provide appropriately.
We have just about 20 seconds before we got to take a break, but Dr. Redondo, I want to just jump in quickly and ask if you can give viewers some examples of common diagnoses and whether or not they need an antibiotic for them.
Well, indications for antibiotics would be many of the things that Craig's talked about. Strep infections, invasive bacterial infections that are of the skin, meningitis, high fevers associated with blood seeding of bacteria. I might also just say that we have now available immunizations that add considerable protection against bacterial infections, some of which are highly antibiotic resistant.
Yeah.
So these are places where our topic of immunization really couples with appropriate antibiotic stewardship.
Absolutely. We got to take a short break, but when we come back, we're going to be talking more about vaccinations and immunizations right here on Wisconsin Doctors. And welcome back to Wisconsin Doctors. We're here on location at Bluff Medical Center in Boston, where we've been talking about antibiotic stewardship and vaccinations as we head into cold and flu season. And Kathy, I want to start again with you. Where can someone get more information so that they can make an informed decision about getting certain vaccines and then also antibiotic stewardship? And also, if someone wants to get vaccines, where can they go?
Sure. The best place is probably to talk to your primary care provider when you go in for visits or talk to them. The other place is the cdc.gov. That is an online, and they have done research and have many resources on their following, so that's a very good place to go, reliable. For getting vaccines, you can get it at the medical center, at the clinic. You can get it at the local pharmacies. You can also get it through public health. They have vaccines there, and those are usually the best places to get a vaccine, is where you are comfortable with.
Yeah, absolutely. And Dr. Redondo, can you share what are some recommended vaccines for adults to get?
the vaccines for adults are commonly customized to underlying chronic conditions, and the listing is pretty extensive. Again, the CDC, or Center for Disease Control, is a website that provides people information specific to these vaccines, both in terms of what the vaccine is intended to protect an individual from, as well as its potential side effects. I think what's really interesting about the website is that it provides information about pre-immunization disease burden compared to what has occurred with the benefit of immunization therapy. Mm-hmm. The website, by the way, is directed to the lay public. It is not laden in medicalese. It's very understandable. It's very useful. Yeah. There are a couple of immunizations that I should talk about that are relatively new. One of these being a vaccine directed to protect people from shingles or herpes zoster, a life-altering infection because it can result in what's called post-herpetic neuralgia, nerve root pain that's very difficult to treat. The risk of this infection is quite notable. For those individuals who have the good fortune to live into their 8th decade of life, the risk of getting shingles is about 1 in 2. So the vaccine, newly available, is quite important.
Wow.
Yeah. We're also now providing adults with boosters for pertussis by way of a DPT. And the reason for this is that we're trying to protect infants. So this is an example of cocooning immunization.
Okay.
So by boosting an adult's immune response to pertussis or whooping cough, we are protecting small infants where whooping cough is quite devastating. Mortality rates for whooping cough in infants is as high as 40%.
Wow. Yeah. And kind of speaking on those lines with infants and children, what is the recommended vaccine schedule for kids?
Well, again, this gets to be very, that turns into a half-hour discussion.
Sure. We'll be right back.
But there are, again, some newer immunizations that I should advocate.
Sure.
And probably one that is most notable in adolescent or pre-adolescent age groups is vaccine to protect against a cancer caused by human papillomavirus. Human papillomavirus is now recognized as being the cause of abnormal pap smears and cervical cancer. So this is the first vaccine become available not to prevent infectious disease, but to prevent cancer.
Wow.
Yeah.
Wow. A lot of great information there. Craig, I want to jump over to you real quick. And, if you look at the vaccine schedule for kids now compared to even 30 years ago, they're getting a lot more vaccines because there have a lot more vaccinations have been developed in the last 30 years. Is it safe for kids to get all of those vaccines in the time period that they're getting?
Yeah, absolutely. A couple things I'll share with regards to that. According to the Center for Disease Control, if we gave all 16 of the required vaccines, which we don't, but if we gave them all at the same time, that would only challenge about 1/1,000,000th of the child's immune system. So it's very small compared to what they would get with an actual active infection. Second thing is the CDC would suggest that only about 1 in 1,000,000 actually have a serious reaction to a vaccine. Now that's something beyond a little pain in the muscle, little sore muscles afterwards, fever, headache, those kinds of things that we see more frequently. That's something that's really significant or serious. So as you can see, they're extremely safe. The second thing that I would share is that measles, as an example, the active infection kills 1 in 500, where the vaccine hasn't killed anybody.
Right.
And in fact, since we started giving the vaccine in 1963, the death rate has gone down to 0 annually for measles.
Wow.
So it's huge. The safety factor around the vaccines is much more palatable than it is around the active infection.
Yeah, absolutely. So much great information, so much to talk about, so much that we didn't get to talk about. Thank you so much for joining us. We're out of time today. You want to stick around and do another 30-minute show real quick? Well, thanks for joining us today. My guests have been here at Bluff Medical Center. We've been talking about immunizations and vaccinations. That's all the time we have for Wisconsin doctors. From all of us here at CW57, we're inviting you to live longer, live better. We'll see you next time.